heart rate measures the number of times the heart beats per minute, or in other terms, 60 seconds. It is important to identify whether your heart rate sits within the normal range. If disease or injury weakens the heart, the organs will not receive enough blood to function normally. So the following diagram shows the heart rates from birth to 1 year. So the average heart rate from birth to 1 month is 140 beats per minute. 1 to 6 months is 130 beats per minute, while in the 6 to 12 months is 115 beats per minute. So here is another diagram that shows the average heart rate of children at rest. So from 1 to 2 years old, the average rate is 110 beats per minute, while the 2 to 6 years old is 103 beats per minute, while in the 6 to 10 years old is 95 beats per minute. The average heart rate from age 10 to 14 years is 85 beats per minute, with a range of 55 to 115 beats per minute considered normal. Average heart rate for those 15 years and older is 60 to 100 beats per minute. After the age of 10 years, the heart rate of a person should be between 60 and 100 beats per minute while they are resting. The heart will speed up during exercise. There is a recommended maximum heart rate that varies depending on the age of the individual. The resting heart rate can vary within this normal range. It will increase in response to a variety of changes including exercise, body temperature, emotional triggers, and body position, such as for a short while after standing up quickly. So here are the abnormal findings in the pulse rate, the tachycardia and the bradycardia. The tachycardia happens when the heart beats too quickly. So the pulse rate here is greater than 100 beats per minute, while the bradycardia happens when heart beats too slowly. So the pulse rate here is lesser than 60 beats per minute. The pulse rate is exactly equal to the heartbeat, as the contraction of the heart cause the increases in blood pressure in the arteries that lead to a noticeable pulse. Taking the pulse is therefore a direct measure of heart rate.
Morning sir, ako imong medtech student karon. Ako i-check imong pulso. You can call me Tim. Unsa imong pangalan?
David Angelalas.
Edad?
23.
Sige, check na ko sir. Ano sir? Wala.
Okay.
62 sir, normal na. Thank you.
The normal axillary temperature is within 35.5 to 37 degrees Celsius. It normally fluctuates over the course of the day, lowest in the early of the morning and highest in the afternoon and evening. A temperature reading of 37.2 degrees Celsius indicates fever or pyrexia. When a temperature reaches beyond 41.1 degrees Celsius, a person has this condition called hyperpyrexia, an exceptionally high fever which requires immediate medical care. When a temperature falls below 35 degrees Celsius, hypothermia occurs, which is also very life-threatening if left untreated.
Good morning, sir. I am Rihanna Nala, a medtech student, and now I will be taking your temperature. Please slightly open your armpit, sir. Close your armpit. Sir, your temperature is normal.
A person's BP BPM or breaths per minute is what we call the respiratory rate. So we can say that a person have a normal values of respiratory rate when a patient or the person have a BPM that ranges from 12 to 20. And if it is lower than 12 and higher than 25, it is considered as an abnormal values of respiratory rate. The conditions that affect the normal values of respiratory rate includes asthma, anxiety, congestive heart failure, pneumonia, and taking up illegal drugs or narcotic drugs.
We observe the rate, rhythm, depth, and the effort of breathing when taking the respiratory rate. We count the number of respirations in 1 minute by either visual inspection or by subtly listening over the patient's trachea with our stethoscope during the examination of the head and neck or chest. The normal breaths per minute ranges from 12 to 20 breaths per minute. Less than 12 breaths per minute is the condition we call bradypnea, while if it is more than or greater than 12 breaths per minute, it is then called tachypnea.
Good day, sir. I am Faith Evinacion, a medical technology student, and I will get your respiratory rate in order for us to assess your health. May I know your name, sir?
My name is Neljan Tolentine,
Your birthday?
October 23, 2002,
Your age?
18.
Okay, breathe normally for me, sir. Okay, start. Okay, sir, so your respiratory rate is 15 per minute, and that would be all. Thank you.